local, late breaking. This is WBAL TV 11 News at 5.
The Star.
More kids playing the same sport year-round is causing a spike in a certain type of surgery for young athletes. I'm Carrie Cavanaugh. We'll explain straight ahead. A surgery that started as a fix for professional athletes is becoming more common in kids. I'm Carrie Cavanaugh. We'll explain coming up.
Well, the rise of club and travel teams allows young athletes to compete in a single sport really all year round, often with an eye toward attracting college scouts and scholarships. But that single-minded focus is fueling a particular injury in young pitchers. 11 News reporter Carrie Cavanaugh explains in a special medical alert.
Here we're just mimicking the pitcher's motion.
20-year-old David Gately is getting in a workout under the watchful eye of physical therapist Steve Luca.
It's more for him to get explosive.
They're teaming up to help Gately come back from the elbow injury that sidelined him from baseball in March.
Got on the mound, one pitch I felt like basically like screaming pain in my elbow. I was like, oh, it's probably because I just like threw a little different. Next one, just heard like 3 little pops. It was like, and then I just basically walked off the mound.
The Catholic University pitcher says 10 years of competitive year-round baseball led up to that injury. Gately recalls throwing well over 100 pitches per game, several times a week, plus practices.
I was one of those kids who always thought, oh, I'll just like power through, get through it, and then ended up getting hurt.
Luca explains Gately is part of a growing number of young pitchers undergoing Tommy John surgery, the ligament repair that famously saved the career of Major League pitcher Tommy John.
Your ulnar collateral ligament gets stretched and torn, so the docs will go in and reconstruct that.
Pitchers between the ages of 15 and 19 now account for more than half of Tommy John surgeries, according to the American Journal of Sports Medicine, which tracked Tommy John operations in this age group over the past decade and found a 9% increase annually.
The amount of 12-year-olds, 13-year-olds, 14-year-olds that are in here now has just spiked up dramatically because of the year-round throwing, playing on multiple teams, showcases.
We got an idea of just how intense the pressure is on young players to maintain a competitive edge and appeal to coaches and scouts when we approached several high school players who are contemplating Tommy John surgery. They and their parents declined to be a part of this story because they were worried that exposing any injuries now would limit their future playing opportunities. Players recently took time out to talk about that message at this youth baseball camp.
When you throw a lot, baseball is a sport where you can also get injured.
Players and parents were encouraged to follow daily pitch count guidelines from USA Baseball and pull pitchers who hit the limit. Gately admits it's difficult to walk off the mound when you're pitching well, even if you're worn out. But he's learned that
If you rest your arm when you're younger, you'll be fine by the time you're bigger, stronger.
Gately hopes his story will help other young pitchers avoid overuse and the pain of Tommy John surgery. Carrie Cavanaugh, WBAL TV 11 News.
And Steve Luca tells us it takes 1 year for an athlete to come back to baseball after Tommy John surgery. He adds the average pitcher can play for about 3.5 more years after recovery.